Hello everyone, we are Anand Bajaj and Sikandar Kanungo of class 10th with our project Diabflux. Diabflux is a research project exploring the potential of short-chain fatty acids in the treatment of type 2 diabetes mellitus or T2DM.
Type 2 diabetes is a chronic condition characterized by insulin resistance and high blood sugar level. Our research focuses on the role of gut microbiota in producing SCFAs, which we believe could help improve glycemic control and reduce inflammation in T2DM patients.
The aim of Diabflux is to investigate how SCFAs interact with specific receptors such as TGR5, PPR gamma, SGLT2 and FFAR3 which play major role in glucose metabolism and insulin sensitivity.
We also explore how SCFAs may reduce chronic inflammation, one of the main contributors to the progression of T2DM, and how they could potentially preserve pancreatic beta cells, which are responsible for producing insulin.
To achieve these goals, we employed molecular docking simulations to study the binding interactions between SCFAs and the receptors mentioned earlier. This computational approach allowed us to understand how SCFAs could potentially influence metabolic pathways.
Additionally, we conducted in vitro studies on pancreatic beta cells and in vivo experiments using animal models to evaluate the overall impact of SCFAs on glucose regulation and inflammation. We also compared the efficacy of SCFAs with current T2DM treatments like metformin.
Our molecular docking results are as follows. SCFAs show stronger binding affinities to key receptors like PPR gamma and TGR5 compared to traditional drugs, which suggests a better potential for glucose regulation with fewer side effects.
We also found that SCFAs have potent anti-inflammatory effects. By activating TGR5, SCFAs can suppress pro-inflammatory cytokines and improve overall metabolic health. Further, they support gut health by promoting beneficial bacteria, which is linked to better glucose metabolism.
As you can see in the graph, the AC score, the more the negative the AC score is, the better the binding is. The results are as follows. To better understand SCFA's potential in treating T2DM, we reviewed several clinical trials. Here are four key studies that examine how microbiota modulating natrocuticals include SCFA's influence metabolic health in T2DM. A systematic review and meta-analysis covering 68 trial comparisons from 58 studies revealed significant improvements in fasting plasma glucose, insulin sensitivity, and inflammatory markers when patients received probiotics, prebiotics, or synbiotics important for support gut health and SCFA production. A randomized double-blind placebo-controlled trial of 53 patients found that multi-strain probiotics significantly reduced insulin resistance and inflammation markers, showing a positive response to SCFA-related interventions.
Another randomized double-blind placebo-controlled trial with 50 participants found that probiotics fermented milk reduced HbA1c and inflammatory markers, while also increasing SCFA production like acetic acid, supporting SCFA's role in glycemic control. Finally, a scoping review of 45 original studies explored the role of SCFAs and the gut microbiome in glucose metabolism, finding consistent evidence linking healthier gut bacteria and improved blood sugar level. Now let's compare SCFH to metformin, a widely used treatment for T2DM. While both have benefits, they act differently on the body.
SCF is produced naturally by gut bacteria enhance glucose regulation through the interaction with specific receptors like FFAR2 and FFAR3. This improves insulin sensitivity and supports a healthy gut microbiota. Additionally, SCFAs have anti-inflammatory effects which can help reduce complications and associated with T2DM.
Metformin, on the other hand, works by activating AMPK, which is a AMP activated protein kinase to reduce glucose production in the liver and improve insulin sensitivity. It's a well established drug that lowers blood glucose effectively, but often comes with gastrointestinal side effects such as nausea or diarrhea.
Looking deeper, SCFAs have the potential to improve insulin sensitivity and gut health with minimal side effects, though their long term efficacy still needs more research. They are also linked directly to supporting beneficial bacteria in the gut, offering an additional advantage.
While metformin is proven to reduce HbA1c and has extensive long-term data supporting its use, it can cause uncomfortable side effects, and its impact on the gut microbiota is less direct compared to SCFAs.
Additionally, SCFAs might be more personalized as they could be tailored based on an individual's gut microbiota, whereas metformin is typically prescribed based on standard clinical guidelines. Despite these promising results, SCFAs face challenges such as poor pharmacokinetics and limited bioavailability. However, solutions like nanoparticle delivery systems and microencapsulation can enhance their stability and effectiveness.
Diabflux is novel in its focus on beta cell preservation, which most T2DM treatments overlook. By targeting gut microbiota functions, our approach offers long-term benefits beyond mere glucose regulation.
In conclusion, SCFAs have significantly therapeutic potential for T2DM, offering novel mechanisms that reduce inflammation, improve insulin sensitivity, and enhance glucose regulation.
Future research will focus on optimizing delivery methods and conducting clinical trials. We believe SCFAs could lead to safer and more effective treatments for T2DM, ultimately improving the quality of life for millions.
Thank
Thank you
you
for
for watching
watching
our
our
presentation
presentation on
on
Diaflux.
Diaflux. We hope this project contributes to better treatments for T2DM.